Welcome to the January 15, 2014 meeting of the Suburban Detroit Trigeminal Neuralgia Support Group. Hello to all those people around the world that have an opportunity to watch our monthly meetings. Tonight we have Dr. Jamie Cramer, who is runs the NUCA chiropractic practice, Precise Chiropractic, here in the Troy area in a Detroit suburb. Please don't think of what you normally think of as chiropractic, crunching, bending, twisting. This is a much different form, which I won't even try to explain, but Dr. Cramer will cover it with us. I think we have one new member here tonight. Yes. The second item on the agenda is new member introductions, and what we like to do is have the old members talk to you about what experiences they've had with trigeminal neuralgia, medications, procedures, medical professionals and that. So hopefully you can stay for the second item on the agenda at least. We got a little late start, and apologize to Dr. Cramer, but you're on.
Okay.
Shut it down.
I get started? Okay, well, thank you for the introduction, Tim. And I think most of you in the room have actually heard this presentation, or maybe have heard me before. So I'm excited to be back for I think it is the 5th or 6th year, I'm not sure. So it's pretty exciting. And you know, we're going to be talking about, of course, NUCA and the approach to TNA relief and how that works tonight. Just like how Tim said, the NUCA actually stands for the National Upper Cervical Chiropractic Association. Upper cervical means upper neck, and there's no twisting, cracking, or popping involved with the procedure, and it gently realigns your spine to allow your body and your brain to communicate and work best. And we'll talk a little bit through that procedure. My office is in Troy, Michigan, and John R. and Waddles, or right next to the Troy Athens High School. And I've been in that location for about 6 years now, which is time is flying. And before that, I've been doing NUCA actually 10 years now. So it's pretty exciting, and we've seen a lot of success with trigeminal neuralgia and NUCA. It's not 100% success. There's nothing that is, right? But we've had a lot of positive success with NUCA in trigeminal neuralgia or facial pain. So that's what I'm here to present tonight, in a natural, different way of looking at your body. My philosophy is we want to do least invasive to most invasive. We can never undo a cut, and medication may cause side effects, so we want to try least invasive to most invasive, so you know you've exhausted your options along the way. That's just my personal philosophy, and we'll be talking a little bit about that tonight. Okay, so I graduated from Palmer College of Chiropractic in Davenport, Iowa, and Lynn and I actually ran into each other at a restaurant before we came here, and we were talking about the chiropractic degree, and I'm going to take a moment and mention that today. So in order to become a chiropractor, you have to have a 4-year bachelor's degree, and then you go to chiropractic school, which is a 5-year program that you do in 4 years, so it's 8 years of schooling. And not only that, but you take 4 sets of national boards in order to become a chiropractor. And in my case, I actually took 5 sets because I wanted to be able to be licensed in any state in the United States. And you actually have to learn how to deliver babies and do prostate exams and all the rigmarole. So a lot of people don't understand or know that. And you work with cadavers, and there's quite a bit of education to this. It's more schooling than a medical doctor in hours. So a lot of times people don't realize that. And I don't want to deliver babies or do prostate exams, but in some states like Montana, where you could be 1,000 miles away from someone that could help you, a chiropractor may be the closest person to help that person. So it's pretty neat stuff. And so I graduated from there, and actually I'm going to introduce Natalie. If you could stand up and just wave to everybody. Natalie is currently at Palmer College of Chiropractic, and she graduates literally next month, and she's going to be a NUCA chiropractor, and she's interning at our office right now. So she is spending her last trimester of school learning in a real-life NUCA office. And so Natalie has been awesome, and she's excited to learn tonight too. So that's it. If you guys have any questions, Natalie's here too. So she's a great, great resource. Upper Cervical Chiropractic, Precise Chiropractic is located in Troy. I mentioned over that. And the reason I got into NUCA, how many of you have heard my story? Most of you in the room? Okay. So I just want to share this because it's really important to me. I actually became a NUCA chiropractor because it saved my life. I was in a major, major auto accident when I was 16, and after I was in my auto accident, I suffered with debilitating migraine headaches, numbness in the hands, horrific back pain, and I vomited almost every day for 3 years. And at the time, every time I went to my medical doctor, I got a lot of drugs, and it kind of doped me up, and I was still not getting better. And I'm this vibrant 16-year-old, right? And my health was declining, and it continued to decline for 3 years. And a friend of mine said, you should try chiropractic. And I didn't know about chiropractic because I grew up in a really medical-based family. That was not something my family did. It wasn't an option. And so when I discovered chiropractic, I was actually in my pre-pharmacy, because I was originally going to be a pharmacist, training, and I went to the chiropractor, and it wasn't NUCA chiropractic, it was regular chiropractic. And I went and I had chiropractic done, and she explained to me some of the things I'm going to explain to you tonight, and it made sense. And I actually got a little relief. Not like tremendous, but I was like, wow, there's something to this. This kind of makes sense, because I wasn't getting relief with the other options I was already doing. And so I sought out other types of chiropractic at that point. And when I found NUCA, literally my prayers were answered and the sea parted in my world, and that's actually why I became a NUCA chiropractor. So that's really important to me. So I can tell you without a doubt this stuff works, and I see it every day in my office. You know, I never claim to cure anything. I want to make that really clear. But what I do is get the body into alignment, and then your body can heal from the inside out. So everything that you need to heal is within you, because our bodies are self-healing and self-regulating. Okay? We cut our finger, the Band-Aid doesn't heal our body, we heal our body, right? So it's really, really important to understand the basic. The only time your body cannot heal is when a nerve is completely severed. Otherwise, it always has the potential to heal. So that's a really important thing. I had this lady, I'm diverging a tiny bit, but this is a neat story, had a subdermal hematoma. Do you guys know what that is? The brain bled. And she had this happen over 20 years ago by the time we met, okay? Her name's Barbara. And Barbara lost the function of, I think it was her right side of her body. I'm kind of going off memory here. And so when I met Barbara, she kind of walked, and she had that, you know, that swing to her gait when she walked. And her, you know, she didn't have full range of motion in her arms, and she came in because I took care of one of her family members, and that's how typically people find my office, is through word of mouth, which is really great. A little bit from the radio station, which I do love. I'll share that in just a minute with you. And so I met Barbara. She came in for pain and discomfort, and we helped her with those things. And after about her 5th adjustment in my office, so it wasn't like the first one, I want to make that really clear. It was about her 5th when she came in, and she goes, Dr. Cramer, you fixed my foot. And I go, what are you talking about, Barbara? We haven't even talked about your foot. What's going on with your foot? Well, from that subdermal hematoma, her toes had curled up. And remember, this injury happened 20 years ago, right? And her toes uncurled. And it was because we got her body working right, okay? And the reason I share that story is because even if you've been suffering or know someone that's been suffering for a long time, it doesn't mean it always has to be that way, okay? I share that story very, very, it's a very important thing, and your body still has the potential to heal. So as I was saying with Barbara, your body has the potential to heal, and I just really want to make that really clear, because part of my mission is to inspire hope for people that are hopeless, okay? Because that's part of our mission with our radio show. And just to let you guys know, for anybody that didn't listen last night, I'm on 103.5 FM, WMUZ The Light, every Tuesday from 9 to 10 at night, and I'm going on my 4th year doing this program. Myself, who does NUCA, and another doctor in Ann Arbor, who also does upper cervical work. So Dr. Lazar is his name. So him and I have been doing the program for a lot of years. How many people have heard that in the room? Cool. So we've had a few people listen. And it's a great show. We talk about all different topics every week. I mean, we talked, last night was trigeminal neuralgia in preparation of today. We've also done low back pain, to anxiety, to you name it. And that's actually how Joan and I met, was because we were doing a facial pain talk that day. Was that right, Joan? When you heard the program?
No, you was doing a regular program.
A regular program, but you just heard pain and you were in. Okay, got it. Because we had, everybody read this book? You read that in the back, sir? And right here, ma'am? You read this book? No. Okay, do you have a book? No. Okay, we're going to give you this book here today.
Mention it for the people at home, the name of it.
Sure, and if you want to see if anybody else needs it. This is called What Time Tuesday by James Tomasi. And this is a book about trigeminal neuralgia and about how NUCA and upper cervical saved his life through with his TN. And the interesting thing about this book is his wife heard a program about a chiropractor on the radio, and that's how she found it. like, and got her husband there. But the whole point was I've done the show with the author of this book before. So it's a really good one. I don't know if we have it podcasted or not. So really, really cool stuff. So I think we covered everything there. So we'll keep going here. Oops. Uh-oh. Okay. Oops. There's a book, a textbook of medical, a medical textbook, and it even has a page on there called Guith, and it talks about trigeminal neuralgia, and it says lancinating pain occasionally occurring in some people over one side of their face and the sensory distribution area of the 5th or 9th nerves. The pain of tic douloureux can usually be blocked by surgical cutting the peripheral nerve from a hypersensitive area. Furthermore, sometimes the operation is unsuccessful, indicating that the lesion causes the pain is in the sensory nucleus of the brainstem and not in the peripheral nerves. So, this is the definition of trigeminal neuralgia according to Guith and Hall. Now, this is the leading textbook that they give in medical school and in chiropractic school. Okay, and I'm going to point out. Oops. I keep having problems with this. So it's a leading textbook, over 800 pages, and only 1/3 of a page is devoted to trigeminal neuralgia. So I think I talked about this on the radio last night, actually. So I bring this up is because it's such a condition that is not cut and dry. Everybody knows that it's not black and white. And so in the medical field and in the chiropractic field and in the dentistry field, there's a lot unknown, right? There's a lot unknown. So it's really important we're going to go over causes of what could be causing the trigeminal neuralgia, and everybody's a little bit different. And that's why there's not this glorified one thing that everybody goes and does and it's successful. So I want to make that really clear. I might need a So let's go over this. I talked about this on the radio too. So you have your brainstem, and if everybody goes right between their ears, if you envision it, that's where your brainstem is, okay? And your brainstem is actually where the origin of the trigeminal nerve sits, okay? So that's the origin or the nucleus of the nerve. And then it says, and this is a little bit up close, you can see the yellow arrow there. There's the brainstem, this blue, where it's blue there, it comes out, and the trigeminal nerve is the 3 branches that come out of that. So can you imagine that even being in your body? I mean, that's just crazy. And the trigeminal nerve, one for each side of the face. Each nerve has 3 branches. We've got the ophthalmic, maxillary, and mandibular. And sometimes we can have pain in all 3 areas. Sometimes it's just one in here. Sometimes it's just a tiny portion of that. So I'm going to need help with this. Okay, thank you. And then this is showing right there where, showing right here how these come out of the skull into your head. Okay, so the origin is where it starts, its exit points, and then its distributions are where it goes. So this is really cool. I think this is a really great chart. You can see where people can have pain. So this is the first branch. And actually, Tim helped me with this last night. It was when I saw Dr. Stoller and we each went through each one of those branches, didn't we? So there's that first branch and what it'll cover sensory on your face, the second branch, the third branch. And then back here, what I have found with people that have had trigeminal neuralgia is that, in often cases, a couple things I have found over the years. One is oftentimes I find that when people have trigeminal neuralgia, they also have a hip problem or a low back problem associated with their facial pain. I don't know if anybody's ever experienced that in this room, and I know a few of you personally have because I know you. So that's often connected because when your head goes off center, if it's out of alignment, it'll cause your base to be off and it'll cause pressure down there. So I want to make that really, really clear. And then the other second thing that I noticed with trigeminal neuralgia is a lot of times people have their occipital nerves, which we talked about on the radio last night. And the occipital nerve is the one that comes at the base of the skull and wraps up to the face. And it's not really on here, but it starts right there and it kind of wraps up and around. And that's really common with those people too. And that, I can tell you, without a doubt, is easier to take care of in my office than even trigeminal neuralgia. That's like cut and dry for us. It's really simple. So that's something, and I had questions on that a couple years ago, and I explained that when I was here too. So if you have someone with that too, that is very easy because the occipital nerve comes right above the atlas, and typically the atlas is out of place. And when we get the atlas in place, it takes the pressure off that nerve.
Is that from whiplash, from a car accident, do you think?
Absolutely. So there's a few different reasons why people can have their atlas out of place. Most common is going to be head traumas and whiplash. And I want to explain something. A head trauma is anytime you hit your head. You have stitches on your chin, guess what? You've knocked your head. You fell down and on the ice and you've hit your head, that's a head trauma. Doesn't mean you've had to have stitches. It doesn't mean you had to have been hospitalized. It doesn't mean you've had to have a concussion. It doesn't mean you've had anything major. If you hit your head, that's a head trauma. Does that make sense, guys? Because if you hit your head, guess what? That neck goes with it. Because it's like a bowling ball on a broomstick. That's how the head and the neck are. So we want to make sure that that's in alignment. So to further that point, so it can be auto accidents, it can be slips and falls, sports injuries. You know, a lot of football players, the average life of a football player, professional football player, is 64. And it's because of all that jamming to their spines. So that's really dangerous stuff. And the number one way people have concussions and head trauma is bicycle accidents. Just to let you guys know. Bicycle, I thought it was football. I read that and I read it again and I go, this can't be right. But it was bicycle because they're not wearing helmets. And they go tumbling over. So that's something to think about. So there's a lot of different reasons. The other reason you can have it is, you know, really any type of trauma to your body. And even if you got blown in the lower back, the spine is all connected. Now this is really important. A lot of times people think that the neck is separate from the lower back because they're far away, but they're not. I don't have my spine here. I've usually brought it in the past actually. But if you move the lower spine, the upper spine moves with it, and vice versa. So that's why when I deal with the neck, I can move the bottom, and this is a whole body adjustment, even though I only touch up here. It's a beautiful thing. It's the most amazing. And number one thing I help with people is like headaches and neck pain. That's like usually what I see a lot of what come in. Number two, low back pain, sciatica, hip are all together, and that works like butter. Sometimes it's actually easier because the spine has more intricate ligaments that get torn than the lower back because it's more delicate. So it's sometimes easier even for the low back to stabilize with doing an upper cervical adjustment. Even though it's not the area I'm touching, it's wild and cool. So, okay, let's keep going on here. Okay, this is just showing you guys some more anatomy. I think this is really cool. I think it really shows us that there's that trigeminal nerve. There's a big nucleus and the area that it goes into. So pretty cool. Let's see here. And there's some more of that nerve. Okay, so this is really cool. So what's the problem? Most theories about causes of trigeminal neuralgia focus on the irritation of the nerve. Nerves are delicate and it doesn't take much pressure or friction to damage them. So this is the Dr. Seuss study. University of Colorado, 1975. A sciatic nerve of a rabbit was attached to a light bulb. The weight of a feather, 10 milligrams of mercury, were dropped nerve conduction and brightness of the bulb by 50%. Okay? Removing the dime restored the nerve flow. So you only need the weight of a dime on a nerve to have a reduction of 50% of that nerve. That's not much. You guys with me on that? So sometimes it doesn't even have to be this gigantic thing to happen to cause things to have irritations on your body. And that's why a gentle adjustment can help also. Does that make sense? It doesn't have to be this big cracking, big thing that has to happen. So when damaged nerves transmit messages of back pain to the brain where the messages register and we do feel effects. So this is really cool. So the composition of the nerves. Usually this is what people tell me they really like about this talk, so I hope you guys like it. It says, any nerve in the body is composed of many thousands of nerve fibers. So picture a piece of PVC tubing filled with thousands of straws. So let's think about this. We're going to talk about general nerves, and then I want you to relate it back to trigeminal neuralgia in your face. So you've got a PVC pipe, and inside the pipe we've got thousands of straws, red, white, and blue. Okay, we're going to be patriotic tonight. So we've got these red, white, and blue straws, and each one of those straws represents a different type of nerve. There's three major types of nerves in your body. You have a motor nerve, which controls your muscles. You have a sensory nerve, what we feel, and we also have an autonomic nerve, which controls how your organs work. You guys with me? Motor, sensory, autonomic. Inside the PVC pipe, thousands of straws, red, white, blue, and the red's going to be sensory because we think of pain. The white's going to be autonomic, and the blue's going to be motor. Now, the arrangement of those straws are different from each of us. Okay? So, one person can have all their sensory or red ones on the outside of that nerve or that PVC pipe. So if they get a tiny bit of pressure, they're going to feel that. Okay? And someone else could have that same pressure on the nerve and all their sensory be in the middle and not feel it at all. Does that make sense, guys? You guys follow me? So that's why someone can have nerve compression or nerve irritation, and somebody's going to feel it and someone's not. Does that make sense? And then the other thing is where we feel the pain can be different based on that arrangement. So maybe your trigeminal nerve is affected, but you may be feeling it in one branch and not the other, but it's still compressed in both branches. Does that make sense, guys? Okay, that's a really important thing. So it doesn't matter if it's in the trigeminal nerve, if it's in the low back, it's in the index finger. It happens anywhere in the body. And that's what's really cool about what we do in the office, which I'm getting a little ahead of myself, is why we have different devices to measure if you're in or out of alignment. So there's no guesswork if there's compression or not, because you might not always feel compression. Does that make sense? Okay.
Sounds like magic. If it works, that's great.
It does work.
Yeah. I know. We've had people there.
Yeah, and it saved my life, and actually Natalie, I'm just going to share this real quick. Natalie got into NUCA because it saved her mom's life. Her mom was supposed to go in for surgery, and she went and had NUCA care, and it saved her life, and Natalie was so touched she went to chiropractic school for that. It's amazing. Yeah.
Well, we've got people, John and your wife still go, right? Yeah, you still go. Yeah, and that's more than that.
Oh, yeah.
I think you may see me shortly.
Cool. I know, you're just right down the street
from me.
I know,
I can always walk.
So I just explained pretty much this entire slide. And then it just says at the bottom, this is true of the trigeminal nerve or nerve compression on the sixth nerve, which would be in your lower neck. So it's a really huge concept, and it's a really life-changing concept, okay? So someone could have compression and they have asthma, someone could have compression and they have trigeminal neuralgia, someone could have compression and not feel it. You guys get that? Okay, good. That's huge, okay? So now we understand that there's pain, what can be done? So medication is a really common option for trigeminal neuralgia, and I know some people, that's what they have to do because they've exhausted other options. So I just want to generally talk about the medications. Painkillers to mask the messages from the damaged nerve is an option, and many types of medication currently used were originally developed to combat epileptic seizures. Oops, I don't know what happened here. Excuse me, I'm having a vascular decompression. I know a few of you in the room might have had this. Microvascular decompression, we take the pressure off the nerve, a portion of the skull is removed, wrap the damaged nerve in Teflon, and then replace the removed section of the bone with a wire mesh screen to prevent the skull's integrity. So it shows there at the bottom. Now I want to share a couple of things about this. So I take care of people that have had this done, and it worked for them for a while, and then for some reason it stopped working, and they've come in and they've responded beautifully to care. Okay, so I just want to share that because I get people that come into the office and they go, well, I've had neck surgery, can I get this done? Absolutely, because there's no twisting, cracking, or popping involved, or low back surgery, or pretty much any surgery. The only way I can't see you is if you've had your atlas bone, which is the top bone of your neck, C1. If it's ever been fractured or burst, I can't see you, or if you have a cyst at that level of your spine, which I've only heard of once in 10 years. So it's very, very rare, and we have different ways to figure out and test you on those things also. But, so I do want to mention, if you've had this done and you're like, cool, that's great, but if you've had it done and you're not doing so great, it's still a viable option to have the NUCA done.
Has Nell Scribner come to see you recently?
Who?
Nell Scribner, S-C-R-I-B-N-E.
I don't think I know that person.
She runs the Detroit group. Did she call you today, Elaine? Yeah,
did
she's
she
calling
listen
from the
last night?
hospital. Duthiconda wants to do a gamma knife on her, and I think I need to call her tonight and
talk to her about
have her consider this.
Yeah, you know,
she's going to call Casey.
About 5 years ago, I think it was about that, I went down, I met Nell before.
You did? Oh, that's what I thought.
I think it's Nell. I mean, this was
Nell
a while
and
ago.
Lana. Nell and Lana run the group.
Yeah, and if they were still running it 5 years ago, I think I met them, and I went down and I did a talk at the Detroit group, and I did this presentation there also. So I did meet them a while ago.
She had an MVD, and it hasn't worked.
And it hasn't worked.
Considering Guthiconda wants to do the gamma knife, and I told her to talk to Casey about the glycerol. But
she's had lots of glycerol.
Hmm?
I thought she's had
No, Lana's had it, but she hasn't. As I understood it, unless I'm
and I know that they do this in mid-Michigan, correct? Or they were doing this in mid-Michigan?
No,
Gamma
no, they do the gamma knife.
Excuse me, the gamma knife. They've sent me people though. The
He
gamma
passed,
knife group.
he passed away. Dr. Copeland passed
Yeah.
away.
Yeah,
He
the
wasn't doing the
Yeah.
MVD.
No, I just got them confused. Mid-Michigan sent me sent us a few people, and not in a while, but it was a
Right.
few years back. A few people came in from
Yeah.
that, yeah, because they were looking for other options.
Dr. Cramer, I just wanted to ask, do you change your position where you
Adjust.
do your adjustment?
Mm-mm. You know, how I determine how to adjust is based on the specific x-rays we take, and they're all like laser aligned, and we have
But I'm
crazy
talking about like
equipment.
when you've done when you've had an MVD.
No, it hasn't been a problem with
So it's-
anybody.
You
I-
still press right there.
Yeah, but usually the MVD is back, and where I press is exactly under the ear. So it's not been a problem. And some people have had it. So in my experience, I've had 4 people that have had MVDs in my office, which is, I think, kind of a lot, to be honest with you. And every one of them, it has not been a problem. So, and I have 2 that are, is it 2 or 3 that I'm currently seeing. So, and definitely not a problem. I know the 2 for sure off the top of my head, and the 1 has actually been here before. No, yeah, for sure 3. I got 3 off the top of my head that are currently being seen.
Apologize.
So when she asked about the MVD and that being in the way, it depends on the type of misalignment you have. With the precise x-rays we take, you can be misaligned one of 10,000 combinations, and 5,000 are on the right and 5,000 are on the left. So it depends on if the site, the way the atlas is drawn, like let's say you have the MVD on the right, and the atlas has gone to the left, and you need your left side up, it's not even going to be an issue. Do you get that? So it's only going to be even a 50% shot, it'll even be on the same side, and of the people it has been a complete non-issue because it is done back further than the area that I touched. Does that help?
Thank you.
Yeah, you're very welcome. So, okay, and then the gamma knife, who we were just talking about, and the gamma knife projects 201 very fine beams of gamma rays generated by radioactive cobalt through the skull to the brain. Has anybody had that done in the room? Yeah. And it's a dose of radiation along with 1 beam is too small to do any harm by itself, but the point where all 2001 beams intersect, a very high dose of radiation can be given with little or no radiation to surrounding tissues. And that was from the former TNA support group. Yeah.
Well, it's still TNA, it's now FPA, but it still uses
Yeah.
the same.
I love the new name. I think it's
Facial pain.
I love
Well,
it.
they tend to broaden the mission beyond trigeminal neuralgia to include other things. You happen to mention TMJ. I'm not sure they're too much into TMJ.
Oh, I didn't mean to say that.
No, that's fine. Nobody would, but other than me, would hear that. But just for your information, I'm not sure we're dealing too much with TMJ at the national level, are they?
So,
Lynn?
I don't think so.
Yeah.
so is there another way? And that's where we're going to talk about upper cervical and nucleus. The principles of upper cervical chiropractic, the body is self-healing organism. We talked a little bit about that. I cannot stress that enough. Your body is self-healing and self-regulating always, okay? Now, we have different rates of healing based on our age, right?
Yeah.
And also based on how long the problem's been there. But it doesn't mean you cannot heal. I cannot stress that enough. I can't, I want to shake people sometimes when they say, well, I've had it so long, I'm just so old. And I just want to shake people and be like, no. My oldest patient that I've taken care of to date is 99 years old, okay? And that woman was happy to come into my office, okay? The youngest person I've ever taken care of has been weeks old, okay? And everything in between. Natalie, how old was the baby we adjusted yesterday?
2 months?
2 months yesterday.
How did they know something was wrong? Were they screaming in
They
pain
come
or
in because
something?
they have acid reflux, or they have
Oh.
colic, or they
Oh.
have something like where they wrench the neck up, torticollis, and those are the types of things. And I am just attracting babies left and right. I think we had 4 infants in the last month start care because they don't want to give the child Zantac. They want a natural approach, and that's what they offer right now when you have acid reflux.
Yeah.
Okay? And those babies can get out of alignment through the birthing process. If there was suction, forceps, trauma, pulling, yanking on the head, or something else happened. I mean, people could be misaligned from birth. Okay, I can't stress that enough. And not all of them are. I had a baby come in, and the mom brought her in to have me check her because I take care of the whole family. She goes, Dr. Cramer, I just want you to check out, my baby here. And I said, she's good. She doesn't need adjusted. And we didn't adjust her. She's like, well, I'm going to bring her back later and have you check her after the kids play with her,
You
So-
take x-rays on them?
No, not on infants. Their bones aren't formed yet. But we have other tools like our scanning device. We have the thermography imaging and the surface EMG that we do in the office. And then also with my pediatric seminars that I've gone to, I have all my baby checks. I call it baby Nuka. So it's really great, and the parents get to hold the baby while I'm adjusting them, and it's just, they usually fall asleep while I'm adjusting them, and it's amazing. The parents love it because they usually sleep for a day or two if they're infants. So it's really, really nice. They come in and thank me afterwards. So it's really fun. Okay, I got off topic there, but that's a fun topic, isn't it? Who doesn't love babies?
It's good you're not excited about this procedure.
I know, right?
Kittens turn into cats. Don't forget that.
What's that?
Kittens turn into cats.
Yeah.
True. I don't have the kids yet, so.
Speaking of 3 children.
Yeah.
So what we've got here is, oops, I'm hitting this the wrong way. So,
Oh, watch it.
I am,
Yeah.
sorry guys. So this is right here. I'm going to go over this chart right here. So this is your brain, your spine here, your neck. This yellow bone right here is that atlas bone. It's a 2 to 3 ounce bone that sits on top of the skull. So it's a 2 to 3 ounce bone that sits on top of an 8 to 10 pound head. So again, it's like the broomstick on top of the bowling ball. So that's really easy to get off place. But the major thing we notice on here is this part right here, and that's your brain stem. There's over, I don't know if it's 3 trillion or 7 trillion, but we'll just say trillions of nerves in this area right here. And if that atlas gets out of place, it will affect those nerves in a negative way. And that's actually where every single muscle control center in your whole body sits, okay? So the control center of how your muscles work are right there, okay? So if that atlas gets out of place, it's going to cause the muscles to become tight and weak throughout your body. And then when that happens, it causes the shoulders to come off, the hips to come off, everything to get twisted, and then your brain can't send the signals out to your body properly, and we hurt and we don't work right. So I went over that really quickly, but we'll go over that again throughout the presentation. So the brain controls all the functions of the cells at all times. Nerves transmit these signals, and when the atlas or top bone of the neck is misaligned, the transmissions of these signals are disrupted. Okay. So over time, misalignments decrease the body's natural ability to adapt, and this results in symptoms. This is really, really important, because I talk to people about this through their care. What happens is when we get adjusted, we start to feel better, okay? And then when we start to feel better, we're noticing over time, our bodies are beginning to adapt. And what that means is I go out to do the yard work, or I go to do this project, and in the past, when I would do this project, I'd be hurting for a few days. And now I'm sore for an hour, okay? Because that's your body's ability to adapt. A healthy person is an adaptable person, okay? I'm gonna repeat that again. A healthy person is an adaptable person. So if you're not adapting to your stressors around you, we've got to be concerned, okay? So we want to be adapting better and better. And even if it's continuing to, it needs to be going in that direction of adaptability, not in unadaptability. Okay, does that make sense, guys? Okay. Okay, where are we at here? Upper cervical doctors and chiropractors detect and correct these misalignments. And how do we do that? So I talked about the x-rays. X-rays in the office are very important for someone that's got their bones fused. Okay, I'll make that really clear. We take 3 very precise x-rays, one from the side, one from the front, and one from the top, so we get a nice 3-dimensional view of exactly how that atlas can be misaligned. We figure that out. We also measure your posture, and we also do an EMG scan on your body. And an EMG actually tells us how the motor nerves are working coming out of your back, if they're spastic or not, okay? And it actually gives you colors, and we rate them from really good to very severe, and there's a few different categories in between. And not only that, but we monitor that over time. So it's not just a one-time deal, right? So it gives us information of what's going on. So I cannot stress that enough. And if you go to an upper cervical doctor, I want to make sure they take a post x-ray after your first adjustment. If they do not, they are not doing upper cervical work. This is very important, okay? Because sometimes people think it's really cool to say they do this work, and they're not really doing it, okay? Most people are good. I think that people are good people, but on occasion I've met people that have kind of went with some people that weren't doing that and saying they were doing upper cervical or NUCA, and that's not what happened, okay? So I just want to do that as just a general warning. Check the national websites and see what conferences they've been to. Ask the questions if they take post x-rays after the first adjustment. So anybody listening anywhere else in America, those are some things you're going to want to check, because it's a really great screening tool for people. Because I've had people that have been in other offices saying, I've had this done, and when they come to my office, they go, they didn't do any of this stuff. And I go, well, this is the standardized procedure that the organization goes by.
Are they doing Nuka in Europe, do you know?
Yes, I actually know Heidi Grant is doing it in London, England, for
Oh, okay.
sure, just off the top of my head. So she's in the research of upper cervical
Yeah.
diplomate, so I know her personally, and she speaks at some of the conferences.
Okay.
And I'm actually on the Professional Opportunities Committee for the national organization and go to some of their board meetings, so they're pretty strict stuff, just to let you guys know. It's, the standards are very high, okay? The nerve signals, when they get through properly to the intended target, over time the body feels its stuff. Now I want to make that really clear too. When I start adjusting people, guess what? You start to feel better, but it takes time to heal, okay? It takes time to degenerate, it takes time to heal, and your body has the ability to heal. Actually, it takes typically a month to recover for every year it's been that way, but you get to feel way better before that's happened. But that's for true damage, okay? Okay. So we measure body balance, we check right to left, top to bottom, how's the body balance. So there's two options. You're in a state of alignment, like I talked about that little baby that came in. I said she's cool, we don't need to see her. Or you're in a state of misalignment and we're going to deliver an adjustment. Okay. So this is kind of an example of the posture. And if we have time, I'm going to show you what our posture machine looks like. So this I think might not be working. But you can see that the shoulders are off in the before, the hips are off in the before, and the legs shorter in the before. Let me try that.
Turn it around.
And then the other one is after the adjustment, it balances all out. And the reason why that happens again is because the control centers for your body are right up here. And when you set that in place, the rest of the spine follows, like almost like dominoes, into alignment to allow the brain and the body to communicate. It's actually utterly fascinating how that can happen. Now, when I adjust some people, they tell me they can feel it in their low back while I'm adjusting them. And it's just because it's all connected. Again, the neck's not separate from the low back. And then as we move forward, I even have people that'll come in with just like feet pain. I remember I was taking care of this hairdresser, and I still take care of her and her entire family actually, and she said, you know, my biggest complaint is my feet. Can you help me with my feet? And I go, well, let's check your alignment, see if that could be a precursor. We got her adjusted, her feet pain went away. And then she's like, oh, well, if this could help with my feet, do you think you could help my son with sleeping? And then she brought in her son with sleeping. And that's kind of how it typically has gone. And again, I don't claim to cure any one of these conditions. I check for alignment, and if we can get you into alignment, then your body has the potential to heal. Is that okay? You guys with me? Okay. So let's go on here. So when the atlas is returned back to its normal alignment, the paraspinal musculature of the body will relax. The hips will level out, the spine will return to a more balanced state, and the whole body is aligned. There's no guesswork. We do the pre and post x-rays, and once alignment has been achieved, the patient is checked to maintain the alignment. So those are some examples of some x-rays. This is an example of a before person, and these are, you know, a picture of a picture. They're unbelievably more detailed than that. Natalie and I have been working very closely together on x-rays right now, and we have a digital x-ray system in our office, and it's just bonkers awesome. It gives us such fine-tuned details, because we recently went to digital just about a year ago, and so it's kind of taken like an old film picture to a digital picture, and you can see so much more clearly, and we're finding so much cooler stuff with this on these pre and post x-rays. So very, very cool stuff going on in the x-ray world for us. So TN and upper cervical. So how can upper cervical help trigeminal neuralgia? So these are 3 proposed mechanisms of how that can happen. Okay, I'm particularly fond of the last one, but I'm going to go over that. So pathway of pain. This is really cool. So what we have here is we have someone in pain, okay? And we're showing that pain here. What happens is the facial pain comes in, it goes to this ganglion, and a ganglion is a group of nerves, okay? And it comes in to the brainstem, okay? That's what this pons is, okay? It goes into the brainstem, and what happens is it comes down this track all the way into C1, C2, C3, and C4. So brainstem up here, spine down here. C1 is atlas, C2 is right under it, 3 and 4 are right under that, okay? So, pain. Well, then what happens is it travels down into the neck. Okay, origin of pain, down, and guess what? It comes back up and tells your body to feel it. And if you have something out of alignment here, that could be causing the pain. Does that make sense? We good? We got that, guys?
So what if there's spurs down there? There's nothing really you can do about spurs, right?
Spurs typically do not cause misalignment symptoms in the nerves.
Would cause pain, but
Not necessarily, okay? It's very rare that we see a spur can be on a nerve. And the where they develop is usually the end plates of the vertebra.
yeah.
Okay.
That's what I got. So,
Yeah, so you know, you have to know that where those come out are in a different spot than typically where spurs are, okay? And I'll get questions about that too, about not only about spurs, but what's that? Stenosis. You can have stenosis in your spine, okay? But if you have a misalignment on top of the stenosis, that's like a double whammy. Or having scoliosis, because I take care of tons of scoliosis people. And so the people are like, well, is it the scoliosis or is it the misalignment? But if you have a misalignment on top of scoliosis, again, it's that double whammy. So if you correct the misalignment, it reduces scoliosis, by the way, a tremendous amount. We've seen it a lot of times, especially with our people that go to U of M to their scoliosis clinic. I mean, it's pretty precise stuff. And they've seen reductions of the curvatures with doing this work. It doesn't correct it, but it reduces it and helps people breathe and things like that, and not only feel better. But that's the same thing with stenosis in the spine, is that you can have stenosis in your spine, but if you have a misalignment on top of the stenosis, it could still be the misalignment that's the problem, not the stenosis. The stenosis is a byproduct. Does that make sense, guys? Okay. Let's keep going here. So that was the spinal trigeminal tract. So post-upper cervical corrections, the lower cervical vertebrae are returned to their natural alignment. Stress is relieved on the lower cervicals and their corresponding neurology. This affects the pain pathway and input to the brain where the pain is interpreted. So blood pressure, this one's cool. So we talked about this on the radio last night. A predominant theory about the causing of TN is that there's a blood vessel rubbing against the nerve surface. That's why microvascular decompression is popular. And we wrap that nerve in Teflon. So, NUCA has this really cool study about blood pressure. WebMD published, it was an upper cervical chiropractic cuts blood pressure. Study finds that the Atlas adjustment lowers blood pressure. And this is another caveat about that. A traditional chiropractor can adjust your Atlas one of about 6 ways. An upper cervical or NUCA chiropractor can adjust it one of 10,000. They repeated this study with traditional chiropractic, and they found this study not accurate. They couldn't reproduce these results that they did several times with upper cervical. So I want to make that really clear. It doesn't make traditional chiropractic bad. I love chiropractic. That is my profession. I'm very proud of it. But with this study, it made it very different because your control centers for your blood pressure at your brainstem, and that's where the Atlas is. Does that make sense? Okay. Okay, so it was on March 16th, 2007. A specific chiropractic adjustment can significantly lower high blood pressure, and it was a placebo effect study, controlled study. And the reason it could be placebo is because how gentle the adjustment is. So it feels like you're just taking someone's pulse because we're not wrenching the head around or anything like that. It was 50 patients were divided into 2 groups. Half were given the NUCA adjustment, half were given that placebo adjustment. And the most amount of force, again, was about taking someone's pulse. And due to the leverage systems, biomechanics, and centers of gravity, predetermined x-rays, not much force is required. And that's an example of a NUCA adjustment. That's not me, just to let you guys know. But you lay on your side with either your right or your left side up, and that's the adjustment. I mean, it's like you're almost massaging the neck. I don't like saying that, but that's the most accurate way of describing it. It's just a very light force done at the top of the neck. Okay. Post x-rays were taken on all these patients, and those given the actual adjustment showed the correction of the Atlas alignment, and those giving the placebo had no change in their misalignment. And so compared to the sham treatments, those who got the real procedure saw an average of 14 millimeters of mercury greater drop in systolic blood pressure and an average of 8 greater drop in diastolic. This procedure has the effect of not 1, but 2 blood pressure medications given in combination. So it's really, I have this conversation often in my office with people that are on blood pressure medication that come in and they're not here to get their blood pressure lowered. Say, hey, let's keep an eye on that because that might start to lower over 8 weeks. It takes about 8 weeks for that to occur. And I've had lots of people that happen to. And again, it's not everybody, but we've had lots of people that it's happened to. So that's a really cool side effect. You could come in for neck pain and not need as much blood pressure medication. Kind of cool, right? Like, really cool stuff. And this was an MD that was in charge of this study. Oh, I'm gonna share this with you. This is really cool. So the MD, this is how this study started. So Dr. Dick Holtz, Sr., is in Chicago. Currently, he's 86, I want to say, and he practices a half a day a week. He loves his NUCA, okay? He loves his son's a chiropractor, his wife has been instrumental in it, and he's been on the groundbreaking floor of NUCA. And so this man has dedicated his life to this work. I mean, he is just amazing. He has more excitement in his pinky than I do. And I have a lot of excitement, just to let you guys
You
know.
must have high blood pressure.
He's healthy, man. He's awesome. But anyways, he's a spunky guy. But the reason this happened is he was in the Chicago area and he had a very large practice, because this happened a while ago. And in his community was Dr. Bacchus, the gentleman in the slide here. And Dr. Bacchus was practicing in the general area, and he was having all these patients come in that they were seeing. They had the same demographic of patients, and their blood pressure kept lowering. And he goes, what are all these people doing? And after many years, he went through these files, and he's part of Rush Medical College, and he was looking for studies, and he was like, I'm gonna go see what these people, like, what's the commonality, see if I can find a study. And the commonality was Dr. Dick Holtz Sr. And that's how the study happened. And it was profound because it was on Good Morning America, it was on all the local networks, and it was actually, chiropractic was seen in a positive light, because for some reason it's had a negative connotation to a lot of people in America, and it's really unfortunate because it's amazing stuff. It's amazing. And so this would brought a really good press release to chiropractic. And that's how the study started. And I didn't know that until several years after this published, how that happened, and I just thought it was just a really cool backstory to that. So, let's see here. Okay. The statisticians brought me in the other day, and I actually didn't believe it. It was way too good to be true. They said I didn't even believe it. We had to check everything, and there it was. And it was pretty great. And the reduction of hypertension leads to decrease in constant diameter of the blood vessels, so more space is created in the areas around the blood vessel once there's no longer an engorgement to it, and the nerve has less likelihood of being contacted by the offending blood vessel. So that's pretty cool stuff. So that's another one of the theories with that. Okay, and the last one is the brainstem compression and muscular contraction, and that's when the atlas bone misaligns. It can cause compression on the brainstem, and we started off with the conversation about this. And due to the dural or soft tissue attachment, not bony compression, the result is the same. The integrity of the brainstem is affected. So that's pretty much saying that the atlas is out of place. Okay? And the brainstem is home to many nuclei, and the nuclei is the origin of the nerve, and this is the area that controls the nerve. But again, that causes the contracture in the body, so you'll have a hard time standing up straight, or not necessarily standing up straight, but just crooked. Just a side note, if someone has poor posture, they have a poor spine, okay? Really, really important. Your spine is the window, your posture is the window to your spine, window to your health, okay? So if we know someone walking around like this, we got a problem. You see someone like this, we gonna have a problem. You know, got the earrings hanging down, the glasses are crooked, one leg's always shorter than the other, they gotta hem them different lengths. That's the stuff we're looking for. We got a bra strap that keeps falling down even though they're level on each side. That's the stuff you're looking for, okay? Because that's the window of the spine. And there's a doctor, I have the brochure in my office, he's escaped, Dr. Windsor, there we go. Dr. Windsor, he did a study, and he did all these autopsies, the medical doctor, did all these autopsies on, I think it was over 100 different cadavers. And what he found when he did these autopsies is he wanted to find out what was a commonality of why these people died. And what he found is when he did the autopsy, that he could correlate why they died based on the degeneration in their spine. So if someone had the most degeneration in their lower spine, they maybe had colon cancer, because those are the nerves that go to your colon. If someone had the most degeneration up here, and they've got that dowager hump, and they're getting that going in here, those are the ones that go to the heart, they might have died of a heart attack. Okay? So your spine is not a very, not a very fun thing to talk about sometimes. It's important. Your spinal health is your overall health. So it's important to have that done, and you don't have to have it. but you also don't have to eat right, you don't have to exercise, you don't have to brush your teeth either. But it's a really smart thing to do, isn't it? Okay. So we said the compression we had, contractures, spasticity in many muscles, the tightening of these muscles in the neck and facial region may affect the trigeminal nerve. So what else can upper cervical chiropractic help? The upper cervical correction affects the entire spine. We've talked about that throughout the conversation today. The correction is gentle in nature, not forceful. Just, gentle on that. Because of this fact, individuals who've had surgery, we talked about that, or even hardware inserted may be possible candidates for care. Now, if there is someone that I'm concerned about, I have that conversation with people for side effects, and I can tell you in the 10 years I've been doing yoga, I've had a handful or less of those people I've had to have that conversation with. So most people are candidates. So that's a really good sign too. And it's really cool, in my office and in most upper cervical offices, to anybody listening, you usually can come in for a consultation to meet with the doctor and find out if it's a fit. And I do a pre-screening for that, and we also do some measuring to find that out too. And in my office, it's no charge to come in and talk with us, like me or Natalie, who's also helping out, but primarily me, and right now. And also, it's a service that many of the offices offer. So if you're even considering it, just take a little bit of time and find out. The only thing you can lose is the pain. That's what I say. Okay, and maybe a little bit of your time.
Are there other doctors there besides you in the office?
Nope, no? It's just myself right now.
That's what I thought. Okay.
And we've got a massage therapist. We've got several front desk staff, and Natalie right now is the intern. Okay. So other conditions helped. We've got allergies, asthma, chronic cough, skin rashes. I cannot tell you how many people I take care of with the asthma. Like, unbelievable how many people I take care of with the asthma. And that's another thing. You need to have breath. You need to have oxygen to your body. Literally, was it Monday or yesterday we had this conversation about the transplant?
I think it was Monday.
It was Monday, okay. Monday, Bill came in, and I've been taking care of Bill through a friend of a friend in the office. He ended up coming in, and he's on the lung transplant list right now. And Bill's in his 50s. Bill came in with neck pain, really bad headaches, some back pain too, and he was having trouble breathing. And he mainly came in for his headaches and his neck pain, and he goes, if we can help with the lungs or anything else, that's bonus, right? And that's how most people come into our office when it comes to visceral issues or organ issues. They go, if that can help, that's a bonus, like the blood pressure and stuff. And so he comes in, and we get working on him, and I've been taking care of Bill for a while. I want to say 6-8 months now, okay? He came in yesterday. He just got back from his checkup at U of M. His VO2 levels are off the chart right now. He's breathing so much better.
What's VO2?
Oxygen volume in your body,
okay.
so volume of oxygen. And he literally got taken off the lung transplant list. And he came in, and we were crying together. I guess it was Monday. I know it was this week. Yeah. And he was really excited. And again, I don't say I take people off lung transplants.
You're doing a transplant support group.
I was just thinking that. And again, I do not claim that at all. I don't, I don't want to be responsible for either good or bad. I just want to be a facilitator and getting the body in alignment. I want to make that really clear. But we've got these stories happening. And so, and that's not even why he came in. And we were, honestly, we were tearing up. We were sharing this moment. And it was just a positive side effect. So asthma is a big one. Help a lot of people with it, kids to adults, okay? Arthritis, that means arthritis literally means itis means inflammation. Arthro means joint, inflammation of the joint. Oftentimes we have inflammation of the joint when we're out of alignment because it's wearing unevenly. Think about it. Rheumatoid arthritis is a little different, but still helps with that because that's more of a chemical response. Carpal tunnel. 90% of the time, carpal tunnel problem comes from the neck, not the hand. 90% of the time, I've done whole radio shows on this. Yeah, comes from the neck because the nerves that come out of your lower neck are the ones that go into your hand. Chronic ear and sinus infections. The second nerve that comes out of the top of your neck goes to your eyes, ears, and sinuses. Really important stuff. So you help a lot of people with that. Dizziness and vertigo. I'm on the Nuka's on the Meniere's website, so we take care of a lot of people with dizziness. And that's a tricky one. That just like trigeminal neuralgia, it's very complicated. That's a tricky one because there's several different origins of that. I could do whole talks on just that subject alone, so that's pretty amazing.
What was that again? I was writing about the other one.
Dizziness and vertigo. I could do whole talks on that because there's several origins for people with that. Crystals in the ears, atlas misalignment, tumors, benign, all kinds of stuff. Disc disorders like herniated discs. I get a lot of questions. Can you see me? I have a herniated disc. Would it help? Absolutely. So that's a really, really big important one. Epileptic and seizure disorders, those are neurological conditions. Guess what I deal with? The nervous system. So the two things that make up the nervous system are the brain and the spine, and if they're not being able to talk to each other because something's out of place, we got a problem, okay? I make sure it's in place so that they can talk. Okay, fibromyalgia, that's a biggie, and chronic fatigue. On the NUCA.org website, there actually are fibromyalgia and chronic fatigue studies, along with that blood pressure study, so there's been a lot of tremendous help. Actually, Zenaida, who I take care of, told me that I cured her of her fibromyalgia, and I go, Zenaida, I didn't do anything, you know, and we talked about it. And that was what she was thankful for this last Thanksgiving, as she moved into the new year, so, because she was diagnosed with that. And headaches, migraine, cluster headache, that's what got me into chiropractic, was my migraines, because they were so horrible. I was, you know, taking the Imitrex and the different drugs for that. Insomnia, sleep disorders. I mentioned the hairdresser brought in her son who was having sleeping problems. Yeah, I think I met him when he was about 14, and we got him in alignment. And cool side effect of that is he had ptosis, or drooping of the eye, and he went to all these different eye specialists. And she never told me about this, and we were chatting, and I missed it. I didn't even notice it when he was sitting there, because, you know, the mom was highly engaged in the conversation. I adjusted him, his ptosis went away in his eye, because that second nerve, again, goes to eyes, ears, and sinuses. And then, of course, his sleeping, the first brainstem area goes to our sleeping center, so we typically sleep better after we get adjusted. Irritable bowel syndrome and UC. Menstruation disorders, because again, the nerves that come out of your low back also go into your sex organs. I've had 3 chiropractic babies in the office, meaning that people came in because they wanted to conceive and they weren't able to. And it's not everybody. We've had some people we haven't been able to help, but typically if we get the husband and wife together, and if they have some type of problem down here in the lower spine, their ovaries or their uterus isn't working. So that's been pretty cool.
Is there any NUCA in the UP?
No. The NUCA chiropractor that is the furthest north is in Charlottesville.
And what about northern Wisconsin? You bring up
I don't know about
yeah,
that area. No, I don't know about that area. We've also got MS in there, because that's a neurological pain in the neck, back, arms, legs, and joints. Thyroid disorders, your thyroid sits in your neck, so the nerves that come out of your neck go to your thyroid. That makes sense, right? And TMJ dysfunction, okay? And that's a tricky one too, because it oftentimes can be related to the neck, and sometimes it is a dental issue, but we rule those out along the way. So these are a lot of great things that NUCA can help with, and these are just some examples. I mean, we could have another 3-4 pages of this stuff. So these are some broad categories.
Did we cover the NUCA site, website?
It's going to be at the end.
Okay.
And
make sure
look at that.
Screen.
You
Yeah.
asked and you shall receive. So the websites of interest. We've got the NUCA.org. Also, NUCAinfo.com is my website, so you can find that. We also have 2 other types of upper cervical procedures called Atlas orthogonality and Atlas or an orthospinality. Now, they are not what I do. They're a different type. And once in a while, like I have a lady right now that's going to Florida for several months. You know, our snowbirds. Maybe that's where some of our guests are tonight. And we can't find a NUCA chiropractor for them to see while they're through their program of care or their checkups. So we try to find out a kind of a sister or cousin's type of procedure for them to see while they're down there.
Yeah, there's 2 or 3 that have told me they're going to be in Florida and couldn't make tonight. Yeah.
Oh, really?
Right.
Yeah.
Yeah.
Well, hopefully they can listen.
Yeah.
Okay. And then the last bit is just my information here. So Precise Chiropractic and then where I'm located and my information here. And I want to just show also my website here. Here's our office.
Do you work with medical insurance yet?
No.
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 Why is that?
Because, you know, it's a specialty within chiropractic, and I don't feel like playing the games. They make it about the money, and I make it about the care. And our care is unbelievably affordable, and we offer payment options along the way if you're a non-Medicare patient. So our care is unbelievable affordable. People tell me all the time it's actually a better deal than having insurance half of the time.
Medicare covers it?
Medicare covers 80%
does.
of the adjustment.
Oh, it
Yeah.
does?
Yeah. So that's one, but we're non-participating in our office. But that's not what it's about. And I want to take care of people that want to be active in their care and want the care. Do you know what I mean? When people come in and it's all about that, sometimes they're not there to get better. They're just like, well, I guess I'll use it because I have it. And I want to take care of people that want it and they want to get help and they're going to be active. And I don't have to be told, like, I can only see you this many visits when you're going to need this, because it's not about that. And I can tell you from a personal standpoint, I've always paid for my chiropractic care, and I still pay for my chiropractic care today. Okay, I don't get free adjustments, and I've been doing this 10 years. I still pay for my chiropractor because I value the care so much. So this is just an example here. This is like our front desk area, and there's that device right there. That right there is the blonde girl standing on top. That's actually the measuring device, and that actually measures the hips up and down, and also measures the side and back, and measures your off alignment. So this is a really, really specialized device, and we use that before and after the adjustment. Okay, so that's a really cool
There's
way.
no weight limitation on that, right?
There is, and I think it was like 350 or 400.
Oh, okay, I can get that.
I've had a couple people that big, so I haven't looked this up.
I haven't quite made that yet.
Yeah, some football player kind of people, you know.
Yeah.
And then this is just showing measuring someone's length of their legs. This is some of the information that we use right there. This right there where we're doing the scans that actually measure the thermography and the surface EMG, and it actually measures to see what's going on in your spine. And I don't have a picture of that on there, but it is a cool, you get a printout of it, and you get progressive reports on how things are healing and how we're doing. It gives me feedback, it gives you feedback. This is showing our x-rays that we take and how precise they are. And this is a bad form of me, but this is what the adjustment looks like. My back should not be rounded. I was posing and getting tired. That's not how I adjust. So that's showing some pictures of that. And then what's really cool here is, you know, some information on me in here and some of our team members. We also have tons of patient testimonials you guys can read through here. We're going to work on precisely getting some more of our trigeminal testimonials. Again, we have pages of this stuff. I think Natalie just counted, how many hard copy testimonials do we have in the office?
36 times 2, so 72.
Yeah, we've at least got another 72, you know, of these in our office. I mean, it's just, we have tons of, we've got patient testimonial videos you can watch. I mean, we are literally helping lots of people through this work. And what else
You
do
have
we
a picture of your zero gravity chairs.
I don't think we have a picture.
No.
So after,
Well,
I'd
then
go
you
just
talk
for
about,
that.
yeah.
so after we get adjusted, we have a resting room, it's called.
Yeah.
And a resting room is where you go and sit and let everyone